Hello everyone. Today we will discuss on the topic respiratory system. Respiratory system is also called as oxygen delivery system. Respiratory system is the set of organs that allow a person to breathe and exchange of oxygen and carbon dioxide throughout the body. It is the integrated system of the organ involved in the intake and exchange of carbon dioxide and oxygen between the body and the environment. Respiratory system perform two major tasks. First one is the external respiration and second is the internal respiration. External respiration means exchanging air between the body and outside of environment, and in internal respiration bringing oxygen to the cell and removing carbon dioxide from is called as the internal respiration. Then we see function of the respiratory system. First function is the supply oxygen to the body and dispose of carbon dioxide, filter inspired air. Then third one is it produce sound. It contain receptor for smell and help to regulate blood pH. Now we see the anatomy of the respiratory system. It is divided into two parts: upper respiratory system and lower respiratory system. In upper respiratory system, it consists of mouth, nose, larynx, pharynx, sinus, and in lower respiratory system consists of lungs, trachea, alveoli, and bronchi. Then we see first upper respiratory system, in which mouth is the secondary entry point for the air into the respiratory system. In what is the role of the mouth in the respiratory system? Breathing air in and facilitating breathing. Third one is the water distance. In upper respiratory system, second one is the nose. Nose is the it is the only externally visible part of the respiratory system. A nose is also called as the external nares. Air enters the nose through the external nares. It is divided into two halls. It is called as nasal septum. It contains the paranasal sinus, where air is warm, and contains cilia, which is responsible for filtering out foreign bodies. It provides an airway for respiration, moist and warm entering air, filter and clean inspired air, resonating chamber for speech, and detect odor in the air stream. Third one is the sinus cavities within bones surrounded by the nasal cavity, and their function is lightening the skull, humidity, and temperature maintenance. Fourth one is the pharynx. Pharynx is also called as throat. It is the common pathway for both digestive system and the respiratory system. Originate posterior to the nasal and oral cavities and extend inferiorly near the level of bifurcation of larynx and esophagus. It is the common pathway for both air and food. Walls are lined by mucosa and contain skeletal muscle that are primarily used for swallowing, and flexible lateral walls are distensible for swallow food into the esophagus. There are three sections of the pharynx. First one is the nasopharynx. It is upper part of the pharynx which is located behind the nose. Then second is the oropharynx. It is middle part of pharynx and located behind the mouth. Then third one is the laryngopharynx. It is the lower part that lead to the larynx and esophagus. Then next part of the upper respiratory system is the larynx, which is also called as voice box. It is cylindrical airway ends in the trachea and prevents hollow material from entering the respiratory tract, conduct air into the lower respiratory tract, and produce sound. It contains the vocal cord, which produce the sound when air passes through them. Then we see lower respiratory part. In this, first one is the trachea. In the flexible tube is also called as windpipe. It extends through the mediastinum and lies anterior to the esophagus and inferior to the larynx. Cartilage ring reinforce and provide rigidity to the tracheal wall to ensure that the trachea remain open at all time. Trachea is divided into two tubes called as right and left primary bronchi. Each primary bronchus project laterally towards the lungs. Then second part is lungs. It is pinkish color and each lungs has a conical shape. It is wide, concave base upon the muscular diaphragm. Its superior region is called as apex and there are two lungs, right lungs and left lungs. Right lungs divided into three lobes, superior, middle and inferior, and left lungs divided into two lobes, superior and inferior, because to make the space for heart. Lobes are separated by fissures and the area between the lungs is called as the mediastinum. And what is pleura? Pleura is the outer surface of each lung and adjacent internal thoracic wall that are lined by serous membrane is called as the pleura. Then what is pleural cavity? Pleural cavity is the potential space between the serous membrane layer. Then next part in the lower respiratory system is the alveoli. Alveoli is the tiny and balloon-like structure at the end of bronchi where the exchange of gases occur and surrounded by the capillary and where oxygen is diffused into the blood and carbon dioxide diffused out to be exhaled. Then we see physiology of breathing. Breathing is also called as pulmonary ventilation. It consists of two cyclic phases. First is inhalation and exhalation. Inhalation means inspiration. In this gases enters into the lungs and during inhalation the diaphragm is move downward and contract, increasing the thoracic cavity volume. Intercostal muscle contract and lifting the rib cage and further increasing the chest volume. And then exhalation. Exhalation is also called as expiration. During exhalation, the forces of gases out of the lungs and diaphragm relax and move upward while intercostal muscle relax. Now we see the exchange of gases. Exchange of gases occur by diffusion where oxygen and carbon dioxide move from the area of higher concentration to the lower concentration. During external respiration, gases exchange occur in the alveoli where oxygen from inhaled air diffuse into the blood and CO2 from the blood diffuses into the alveoli to be exhaled, and during inhalation the gases exchange between the blood and the body tissue where oxygen is delivered to the cell and CO2 is taken away. Then we see the disorder of the respiratory system. In this first one is the asthma, a chronic condition characterized by the airway inflammation and constriction leading to wheezing and difficulty for breathing. Then second one is the chronic obstructive pulmonary disease COPD. In this group of lung disease that block airflow and make it difficult to breathe. Third one is the pneumonia. In this an infection that inflame the air sac in one or both lung which may fill with fluid. And fourth one is the lungs cancer, uncontrolled cell growth in the lungs tissue often linked to smoking and environmental factor. Then fifth one is the pulmonary fibrosis. In this a condition where lungs tissue become damaged and scared, it affecting breathing. And last one is the tuberculosis, a bacterial infection that primarily affect the lungs and causing chest pain and weight loss. These are the disorders of respiratory system. That's all about the respiratory system. Thank you.